Hey, Dr. Mac, how are you?
Hey, how you doing, lady?
I'm doing fine today. I'm telling you, it's you already know.
Yeah.
Favorite day of the week. Uh,
Oh yeah.
yes, it's time to just kind of woosah. We've had a long week and
Yes.
uh, a very long past 72 hours because of the
Oh yeah.
election.
Oh yeah.
So there's a lot going on. But first of all, we'd like to, of course, thank everyone for joining us today. I'm April Garner, the network founder, and welcome to the Network Live. We're here every Friday with Dr. Winston D. McIver Jr., owner of Walkmart Primary Care. And we've been doing this thing for the past 33 weeks, bringing you COVID-19 updates and also talking about other issues and business related information and news and all this good stuff. And so typically we'll get into Dr. Mack's COVID-19 updates, but today we have a special guest, and she was riding hard with us one time, Dr. Mack, and then life happened, and but it was great that we could bring her back in today. So I'm gonna go ahead and bring her to the stream. Sister Marilyn, how are you?
I am doing great, April. Thank you. Hey, Doc, how are you? Good to see
It's it's
everybody.
so, it's so good to see you, lady. So good to see you.
Yeah, it's good to see both of you. And I must say, Doc, I missed the bow tie.
Yeah, yeah. It's been busy today. Busy this week, so I'll have to make sure and get it back on.
Very good. I totally understand. Whenever y'all want me to pop in, I'll be happy to pop in if the schedule allows.
Yeah,
Life.
absolutely.
You're
Yes,
right, April. Life happens. So
yes,
yeah,
yes,
but it's
and
all good.
that's right. So, and of course, we were just chatting right before the show started, and just so much, and it happened so quickly. And one of the things that we're dealing with right now, of course, as a nation, is the election. And so, we're going to talk and have a little reflection on what's been happening in the past few days. Since the third, we tried to elect a new president, new senators, new X, Y, and Z, and we have succeeded in some, but we are still trying to tap a new president.
That's
uh
true.
yeah, and I tell you, it's been quite a roller coaster ride. I know a lot of people have lost sleep. My phone's been chiming throughout the night or whatever, but you just have to tear yourself away and say, you know what, it'll be there in the morning. I'm sure nothing is really going to happen that's earth shattering, at least we hope not. But one of the reasons why Marilyn is joining us today is because of a message that we wanted to put out to everyone concerning just safety and something that's been circulating on the internet or through social media. It's a message that supposedly came from the NAACP, and it was a warning to the African American or Black community. I use Black community about just watching out for ourselves because of the presence of certain militia groups that may feel like they want to go a little rogue because things aren't going the way that they anticipated. And so I received several messages of the kind, and just wanted to find out whether or not there was any validity to it at all. And my thoughts were, well, let me reach out to some contacts that we have with the NAACP and see what we can find out. And Marilyn answered it right away. So, Marilyn, I shared that I guess you could call it a viral message with you last night. And
Hmm.
as I read it, my thoughts were, well, I'm sure that yes, we need to be careful for various reasons. But what I don't want people to get absorbed in is the idea of the hysteria that is created around a lot of things. And whether or not they are reading a message that, as you said, is verifiable, or that intentionally came from the NAACP, for one, because it mentioned the NAACP, but just two, just making sure that people understand that there's a lot out there, and so you just have to do your research and find out what's real and what's not. So
Hmm.
just give me your thoughts on what I shared with you, and what you found out about it.
Sure. So let me first say unequivocally that meme posting that you saw is false. It is not legitimate. As a matter of fact, April, when you sent me that message last night, I was actually on an NAACP national phone call
Mm.
that was wrapping up the election. Well, I can't say wrapping up, but
Mm-hmm.
updating us on what was going on with the election and the
Mm-hmm.
results, and with some folks who know even more than I do about this particular situation because it actually came up in the conversation.
Oh, wow.
And
Okay.
they specifically said that there is this meme posting going around that says that the NAACP and a couple other organizations have put out that our black men and boys are going to be snatched off the streets this weekend. That militias are planning on doing that, however way it's worded,
Mm-hmm.
and it is continuing because our the gentleman Jim Felder, who is in charge of the NAACP election efforts this year, has been on the phone most of the day dealing with that rumor. Just, people call it. I heard this
Mm-hmm.
rumor. I saw it, and I told him I would be on this show to make sure that we repeated what we know officially is that that's definitely not the NAACP. You can ignore that particular posting. It's simply false. With that being said, we are urging people to practice precautions and be safe because we know that there are folks who do not want the best for us. That is not false, but no one knows any specific event or
Mm-hmm.
action that's going to be taken. But we are telling people to practice precautions, be aware of your surroundings. We know where we live, we know what country we're in, we know what state we live in. And to be safe, you just need to be aware of your surroundings and aware of the possibilities because this is not in a vacuum. We have a current occupant of the White House who, quite frankly, has said for more than 6 months that this is going to be a fake election. It's going to be fraud involved, which it is not. Thank goodness it is operating the way it should operate. They need to count the votes. I mean, he is doing everything he can to make this illegitimate and also to encourage his followers to, I believe he said in his words, stand back and stand by. And so we need not be naive and stupid about this and not think that we're all human and we're capable of doing some evil things. So we need to take the cautions that we need to take to keep ourselves safe.
Mm-hmm.
And you basically could say that's what we heard last night from Derek Johnson, president of the NAACP, the national president.
Mm-hmm.
Let us not be foolish and practice self-defense. No, we're not encouraging anyone to go out there and be stupid
Mm-hmm.
with our own guns and stuff. What we're telling people is we need to practice self-defense, and that means be aware of your surroundings, be aware of what's going on in this country right now.
Mm-hmm.
Hmm.
And and as I look at the dialogue, and you can't help but be a part of the dialogue because a lot of it definitely is geared towards our community. And as I think about some of the things that are said, and even just thoughts of why it's necessary to be prepared at a time like this. It's just surreal that we even have to have just like one of our viewers just said, that we have to even think about this type of thing right now, but it's a very real thing. And I think that is a part of why we've always had the sentiment moving forward from other things that happened throughout the year, that our lives matter to the point where we have to think about these things even when we don't want to, or we don't think that we need to. And just like you said, yes, there's a lot of information circulating, and you don't want to feed the tensions that are already there. You can be vigilant without trying to be a vigilante. You can definitely just be mindful and aware of your surroundings. And I know that a lot of people are. I have family members who are like, yeah, you got to make sure that you're good. And I'm like, I'm good because, I'm going to mind the business that pays me, and I'm going to keep moving and doing what I have to do. I'm not, ever going to look to someone or seek out, trouble of any kind. And so I think that, people have to also just be mindful that if they feel that the vibe is wrong, or if they feel that they're approaching a situation or approaching people that are not going to be friendly towards them, or that will just intentionally cause trouble just because they feel like they can, the first course of action, of course, is to get yourself out of that situation.
That's
You
right.
don't have to stand there or stay there and be a part of it, or try to even, reason with people who have already figured out in their minds how they want to handle themselves. I mean, we see
Mm-hmm.
that happening
Mm-hmm.
across the country now. And to your point about everything that's going on with the election, yeah, it's kind of crazy what we're seeing as far as things that are happening in these voter centers where they're counting the votes and people showing up with guns. And it's like, why? What is the need for all of that? They're doing their job, and this is a part of the democratic process. And so, just let them do what they have to do, and let's move forward. But I thought that particular viral message was important enough for us to bring it to light in terms of, first of all, like you said, it being false.
Mm-hmm.
We definitely don't want to create any type of negativity around the NAACP, or to make it seem as if they're disseminating false information or fake news. We got enough of that, and so we definitely want to bring that to the forefront. But just also to just kind of reflect on what is happening right now with this election, and why it is important for us to just be patient, be prayerful,
Mm-hmm.
and that's
Mm-hmm.
probably the first P we need to be,
Mm-hmm.
and just be, purposeful in whatever it is that we do and say with good intent, because I don't think that any of us, at least I hope not, wakes up in the morning thinking that we're going to have to defend ourselves simply because we exist in a country where we are, we have a right to exist. But you just never know, because, some people are crazy, and some people have a very distorted idea of what is happening right now to the current president. They're not supporting, what's about to happen, which is a shift, in America. And because of that, yeah, they can do some pretty irrational things. So I
Um,
definitely want to just bring you on for that reason.
Thank you. I appreciate that also. And I just want to make sure that people understand that if the NAACP is going to release any information, which they actually do every day, you are going to see letterhead. It's going to be on letterhead. You're
Mm-hmm.
going to see their official logo, but you could also simply go to their Facebook page and see if the announcement is there. You could go to their website. And if they do release um any information, it's not necessarily going to be in a Facebook posting per se, but it definitely will be in a press release.
Mm-hmm.
So if you see something like that moving forward, you need to go to your resources, go to the NWCP Facebook page. It will be there. It's not going to be some random disconnected, posting. You can simply go to the Facebook page, and if it's not there, more than likely it is not true. You could go to the website. There are different resources you can go to verify whether something is true or not. And I say that for anything that you see,
Mm-hmm.
check multiple resources. And you talk about being prayerful. Well, we go to the church. What do they tell us? Discernment.
Discernment.
We
Mm-hmm.
need to practice discernment, and
Mm-hmm.
that's as individuals we need to do that. I do want to say this, harkening back to what's going on in this country right now, is that we have some difficult days ahead. We need to be real about that. And I know you guys are going to talk about COVID and everything. I'm going to dip out. But what people right now are focused on this presidential race, and we can have another conversation about this.
We
What
can.
people don't realize is that Republicans have done very well in state legislatures and down ballot. They have, but no one's talking about that yet. And what we face now is decisions regarding COVID, because we did not take the Senate.
Mm-hmm.
That's still up in the air. And
Mm-hmm.
we have 3 seats, because if they call it for Biden and Harris, her seat will open up in California.
Mm-hmm.
More than likely, that's going to be Democratic. I mean,
Right.
California is Democratic. I don't see that changing anytime soon. But in Georgia, you got 2 Senate seats that are going to be up. That
Mm-hmm.
will tip the balance of the Senate, which means we're going to have to get to work. That's going to determine how we react to COVID after
Mm-hmm.
January. But even more importantly, we just finished a census that was actually corrupted by the current administration.
Mm-hmm.
They are getting ready to decide reapportionment in mostly state legislatures, and most of them are led by Republicans. And no one's paying attention to that. This will impact us for the next 10 years. So they will actually strengthen those lines to make red states even more red.
Mm-hmm.
And we will have to live under that for the next 10 years. And it will actually make it harder for us in 10 years to flip,
Right.
what we need to do, because they're going
Mm-hmm.
to draw the lines to reflect that. That discussion needs to be had because that will impact everything.
Mm-hmm. And you're right. Now is the time to strategize. We
Yeah.
can't wait until 4 years from now. By then, it's too late because we need
It's
to be
too late.
grooming
Even
people
2 years from now.
even two
We
years from
can't
now. I
wait.
mean, yeah, people
Yeah.
need to be groomed day one. Paige Connolly Watson, great friend of mine, and she's out of the Greenville area. She says, "What can we do for Georgia?" And so, yeah, if as people are thinking about what's going on, because we have had a lot of time to just take all of this information in to try to unpack what's going on. I know that, the three of us have never seen anything like this in all of our years of being involved in politics. And I don't know that our parents or grandparents have ever seen anything quite like this. But what can we do at this point? I think the Stacey Abrams effect needs to kick in everywhere, to be honest. And
Well, truly grassroots. She went
yes,
grassroots. We
she
need to
did.
replicate that. Of course, it'll be different from state to state because we have
Mm-hmm.
different states and situations going on. But the bottom line is she went grassroots, and we
Mm-hmm.
need to do that. We need to. I was talking to some folks earlier today. We need to come together and strategize, not only along elections, along issues
Issues. Mm-hmm.
and policy. There's some changes about to happen in South Carolina people aren't paying attention to, but we need to come together and organize on the grassroots level. We need to develop a strategic plan as much as we can in the Black community. We generally know what we want.
Mm-hmm.
We do.
Mm-hmm.
And
Mm-hmm.
we need to come together and strategize on a community basis. Where do we want to be in 2 years, 4 years, and so on? And
Mm-hmm.
then we need to make it happen. What we can do for Georgia right now is if you know anybody in Georgia who is not registered to vote, get them registered to vote. Because this is a whole new election cycle now. If you are 17 in Georgia and you
Mm-hmm.
will turn 18 before January, you can register right now. You can register as a 17-year-old as long as your birth date will happen before the election because you'll be legal then. So
Right.
go ahead and if you know family and friends who live in Georgia, tell them now, go ahead and get registered if you're 17 and you're going to turn 18 before that election in January. They will be able to vote. Tell folks to get ready now to vote early. Vote, mail in ballot. Basically, it's a whole new start. It's a
Mm-hmm.
whole new cycle, and we've got to encourage people to vote because what's going to happen, in particular with the Warnock situation, is he was able to get into the runoff because there were two Republicans running. They do it by weighted. I can't remember the exact term, but they
Mm-hmm.
weight their ballots. So whoever gets the top, who gets hit, who breaks that 50% can win. So they don't have primaries per se.
Okay.
So it ended up being like about 20 people were actually running, and the top three, basically, or top two, if you don't hit that 50%, then you go
And a
into a
runoff.
runoff. And
Mm-hmm.
that's what happened with Warnock and Loeffler, I
And
believe is how
Loeffler.
you
Yeah,
pronounce
that's
her
the name.
name.
Mm-hmm. Loeffler.
Yeah. But the reason she didn't break the 50% is there was another Republican running, so they split
Mm-hmm.
that vote.
Mm-hmm.
Warnock
Right.
has an uphill battle. That
Mm-hmm.
You
means,
have to talk to
yeah.
he. He's actually a friend of mine from college. He was my college
Mm-hmm.
Okay.
classmate. So I've known Raphael
Mm-hmm.
since '87. Good guy. He's actually the lead
Right.
minister at
Mm-hmm.
Ebenezer, Reverend, Dr. Martin Luther King's church. Yeah, he's a good guy. He's a good man. Sharp
Mm-hmm.
fella.
Yeah, he is.
He's gonna have a tough time because he ran against two Republicans, and
One.
now he's gonna
Yeah.
be
And
running
they're going to
against Loeffler.
consolidate behind her, and a lot of national money is going into the state. But it goes
Yeah,
back to if Biden can squeak it out, sure can Warnock can
right,
squeak it out too.
Mm-hmm.
But that means we got to put
sure, yeah,
a lot of money into Georgia.
right,
And no joke, folks, you got to vote like you
right,
never voted before in your life because
right.
it's bigger than Georgia. This is the future of the country, or
Of the
part of
country.
the future.
Mm-hmm.
And another thing we need to work on is people need to get involved on the city, county council
Mm-hmm.
level. we need to have people running for water and soil commission.
Mm-hmm.
We've got to look at committees and commissions and what application do I need to fill out to get appointed? What do I need to run for? People don't realize you could run for water and soil commission. And in Georgetown, for example, that seat was open today. We were encouraging write-ins.
Right.
And it was empty on election day because they
Mm-hmm.
didn't put it out. There was an open seat. But water and soil impacts our water.
Mm-hmm.
And if you've been paying attention for the last 30 years, the next wars are going to be about water.
Mm-hmm. Mm-hmm.
Unfortunately,
Yes. Mm-hmm.
this is real. Soil is about land. There was a
Mm-hmm.
situation up in Rock Hill. Water and Soil Commission, a member told someone else that there was some heirs property, 300 acres available. Dropped the word to them. White developer was able to come in and scoop up 300 acres of black land.
Mm.
They talk to each other, but no one pays attention to Water and Soil Commission. This is grassroots activism, folks. You want to take South Carolina and make it blue, you got to start at this level,
Mm-hmm.
and then it trickles up. And that's basically what Stacey Abrams did. And people don't realize she's been at it at least 10 years. This
Mm-hmm.
wasn't overnight. We just beginning this battle.
Yeah, I think it. When you think back on the fact that she was running for governor, it definitely was divine intervention that she didn't win. That's what I feel. I feel like she was her what she was supposed to do. She did, and it's so much bigger, like you said, than Georgia at this point. And to your point about everything, Soil and Water Commission, and even other commissions and committees that are city and county based. I think that, our communities lack that education. They don't even realize that these committees and these commissions exist. So platforms like what you have with the Gathering Place, the shows that you have on a regular basis, this platform, Whittemore Community Magazine, we definitely have, we have a responsibility at this point to start educating people on these commissions and these committees so that they will understand what's out there, and also identifying some young people who can, who we can groom and who have the energy to move forward in politics. Because I think that a lot of them are interested. They just don't know how to get started, or they think that it is out of reach for them, because of various demographic reasons or whatever. And that is so far from the truth. So,
Yeah.
I know you have to go,
yeah.
but you're right. We got to have another conversation like this.
That's a whole nother conversation, and
Yes,
it does
is.
impact what Doc does when we talk about COVID.
It does.
And how,
It
and the
does.
stimulus plan.
Mm-hmm.
We're the only country that has not financially supported our own people. It's crazy. It's
Mm-hmm.
crazy. But we got to take back the narrative. And one more thing I want to note before I leave. I started the Gullah Geechee Leadership Institute for times like these, and that is to develop leadership to advocate for policies and issues. It is a 501c4. It's about policies and issues and teaching people how to be advocates for their communities. So you will be hearing more about that. That's Jim Felder is working with me on that, and he's a long time. He has forgotten more than I'll probably ever know.
Okay.
But you'll be hearing more about us. We're actually working right now to we're addressing the Santee Cooper, the state-owned utility situation. The Gullah Geechee Chamber has publicly announced that we are for the sale of Santee Cooper to Next Era Energy, because that is another situation where people don't realize the ramifications and consequences for our community. We have been abused too long by Santee Cooper. And that's another reason why people need to learn about what's going on and get involved and call your elected officials and tell them, we holding you accountable.
I was going to say, it's accountability time. That's right. It's accountability time. I know you have to go. I do want to get this question in from Paige. And it's something that even if you can't answer it right now, I'm sure you can go back to the thread and send her and comment. But how do we keep youth activated for the next non-presidential election and smaller regional elections? We were kind of touching upon that, as far as what we need to do. You were talking about your leadership academy and all of that, but I think now's the time to just start having those conversations with them. We have to identify persons who have an interest like yourself. I mean, the viewers don't even realize your background is political science, So we have to definitely tap into those young people who have a propensity to major in political science, who have been following, the elections and all of that good stuff, and who have an interest in serving, getting them started, I think, at maybe even the committee level, so that they can understand, bigger positions and bigger posts along the way. So,
And some of these committees, you could be 18.
okay. So there it is,
but you
Paige.
just got to do the research. So I'll leave it with this. What do we need to do with our young people? Put them to work.
There you go.
Put them to work.
Mm-hmm.
Get them educated, and then put them to work in the community. But yeah, it's about policies and issues, and we got to be real about that right now. And stay safe.
Yes.
You got to live to work another day.
Exactly. Exactly.
All right, y'all. It's been good. I'll see you later.
It was a blessing to have you here today. Take care. Remember, I told you what to do if you need me.
I will.
Yes,
will.
ma'am.
Thank
yes,
you.
ma'am. And you be safe as well, okay?
I will. Thanks.
Good to see you.
Bye,
Thank
Doc.
you.
All right.
Bye. All right, Dr. Mack. So, that's we had to have that little bit of reflection right there on what's going on now, and just to clear up everything regarding that viral message that's going around. So, if you're ready, we can get into COVID-19 now.
We can do it. We'll kind of start with the graphs, and that'll kind of take care of what I normally start off with. So, all right. First graph. So essentially what's happening is we know that we're having, record numbers of cases. This graph is taken through a compilation of New York Times, Johns Hopkins, and the University of Washington Biostatistics Department, where we're looking over the last 14 days worldwide. The number of cases have gone up 33%. And the number of deaths in the last 14 days have gone up 34% worldwide. So right now we are looking at right at a little over 49 million cases and a little over 1.2 million deaths worldwide. So I like these graphs because I'm really a visual person, and I think people can get things clear in a visual picture. The tail of this graph is going up, and I mean it's going up in an exponential way. Where you look at the far right on the graph, that number is going up, and it's continuing to rise. It did plateau a little bit around August and September, but if you see since October, the numbers have just kind of taken off worldwide. So this is something, of course, that we've been seeing in the news media. Of course, the last week or so, the elections have been dominating the news cycle. However, COVID is still alive and still doing what we figured it would do. The next slide. The next slide really kind of looks at the U.S. and it's looking at the U.S. count. And right now in the U.S., we're looking at a little over 9.6 million cases, and number of deaths are over 235,000 deaths. On the far right of that little graph there, we see we got 54%. There's been in the last 14 days, there's been a 54% increase in the number of deaths in the United States. Excuse me, the number of cases in the United States. And in the last 14 days, there's been an 8% increase in deaths. So although that's a modest increase in deaths, it is still going up and going in the wrong direction anyway. So we're seeing again the right of this graph tailing up, and this is swooping up. Again, U.S. is being hit hard. As a matter of fact, Wednesday was the first day over 100,000 positive confirmed cases. And yesterday, it was over 121,000 cases confirmed yesterday. So again, the thought was by the time we got into November, we would be seeing days of over 100,000 cases. And the worrisome and concerning thing about it is we're still under testing. We'll talk about testing a little bit later. I decided to kind of research and get some more information on testing so you can understand what I mean by that. There's a lot of times that I've been saying we've been under testing, but I've got some slides to kind of show you where we are as far as testing goes, not only national in the US, but also statewide. Next slide. Next slide, we're looking at new reported deaths in the United States. Again, back in April, May, and June, particularly April and May, when the major metropolitan areas, New York, Chicago, Newark, New Jersey, Louisiana, New Orleans, Detroit, when they were getting hit hard, we were at this highest peak. We started having a drop down in new reported cases. We started going back up again in August, kind of tapered off, and we're kind of starting to go on what appears to be an increase since around middle of October. So this is a concerning sign, a worrisome sign that we are seeing more new reported cases. And we know this is not just because we're testing more, for two reasons. Number one, the hospitalization rate is going up in the United States. And number two, excuse me, we're seeing new reported deaths. So this is concerning here as well, particularly in the fact that we haven't even gotten into the winter yet. Next slide. Next slide, we're looking at specifically South Carolina and the graph there. Again, we had big bumps in South Carolina in July and August. Right now, we're right at a little over 181,000 cases and over close to 4,000 deaths there in South Carolina. As far as a 10-day average, we've had a 10% increase in the number of cases in South Carolina and a 30% decrease in deaths, which are good, but there has been a 4% increase in hospitalizations. So the concern there is as the disease increases, the hospitalizations will increase, and statistically speaking, the number of deaths will often start to increase. Now, these deaths are going down because, medicine regimens have gotten better. In other words, there's still no cure for COVID, but there's a lot more information that we know now on how to treat patients with COVID. And fortunately, people are showing up to the hospitals earlier and getting treated sooner, but we're still under tested. Okay, but this still shows you that the graph is still higher than it should be. And we haven't even gotten into winter yet. Okay, next slide. Next slide, looking at daily reported deaths, just kind of showing in South Carolina, a more of an up close and blown up scale there. The numbers were going down. They've started going back up again towards the end of October, and they appear to be dropping down. As I said, the percentages dropped down. But again, hopefully that number will continue to go down, but only time will really tell that scenario. Okay, next slide. Hospitalizations, again, this is just kind of blown up picture on that. We see we're really high July and August. Numbers started coming down, dipped down early October, but has started to, trend up some. So again, still watching this, still having people, encouraging them to be as vigilant as possible to try to do what we need to do, particularly getting into cold, flu, pneumonia season. Okay. Next slide. So I've talked a lot about testing, and I've been asked questions about testing, asking to kind of elaborate a little bit more on testing. And so I decided to bring some information to the show to kind of talk specifically about what we're looking at. So next slide. It's kind of put in the form of a periodic table. Okay. And there's 12 states that actually meet the target for testing. There are 10 states that are near the target, and then there's 29 states that are below the target. And the target is done based off of population in the state, and it's a mathematical equation that kind of says how many people should be testing. It has a lot to do with the positivity rate, which we're still, double digits with that when we should be less than 5%. So that factors into, are we doing enough tests as well? And as you see, South Carolina is in the red, and those red states are the 29 states that are below what the target testing should be. So that's important because we know for every one person that is positive, confirmed positive, there's probably anywhere between 5 to 7, if not higher, more that are positive that have not been tested. Okay, so this is important, and I want everybody to see this to understand exactly what I said when I keep saying we're under testing. This is not just Dr. Mack saying this. It's not just Dr. Mack saying this. It's statistically shown that we are under testing, that we need to test more. Whenever a positivity rate is certainly double digits, that's an indication that there's more disease in that area. In other words, if you go fishing, find your little fishing hole, and you catch fish in this one spot, it's likely that there's going to be more fish in that spot. If the positivity rate is high, it's likely more cases in that spot, which should require and should mandate more testing. Okay. So I wanted that to be clear. Now, specifically on South Carolina, the next slide, we're looking at the daily reported specimen testing. So this is the testing that's being done. So as you see, May, June, July, we started going up with testing. As you know, summer ended, school started back, there was a dip in the amount of testing that was being done. And it dropped down. This is not Dr. Mack. This actually came from DHEC. So the numbers were going down. Then as you see, the numbers are ramping up now, but then on the very tail end of that, the graph went back down. So we still aren't where we need to be. So although this testing is being done, we're still not where we need to be as far as testing goes. We're still under testing significantly, and it's so important to make sure that people, you know, protect themselves. And again, you really don't know the full extent unless testing is being done. Okay. Next slide. Next slide just kind of talks a little bit about the excess death tolls. In other words, if you look at the number of deaths that happened last year this time, there's 266,000 more people that died this year than died last year. Now, that's kind of an indirect measure of COVID. It's not a one-to-one with COVID, because there are other reasons that people can die as a result of COVID, from a COVID-related situation: stress, anxiety, heart attacks, strokes, you name it. But just to kind of give the big picture, all-cause mortality, there is almost 300,000 more deaths right now than this time last year. That's important to understand that too, because COVID is not just it's not just an isolated incident. I saw somebody put on a Facebook post the other day that the CDC went down and they broke down the different causes that were associated with COVID, as if they tried to sort out heart disease from COVID. They tried to sort out strokes from COVID. They tried to separate these things, when in fact there is, in a lot of cases, a cause-effect relationship. When physicians sign death certificates, there is a primary cause of death, but there are also secondary and comorbid conditions that could lead to that death. So in other words, even though the death certificate may say pneumonia, that pneumonia was caused by something. In a lot of cases now, it's caused by COVID. That the stroke's not an isolated thing. So a lot of times there is a reason for that stroke to happen. COVID can certainly do that. Death from COPD. Certainly, you know, COVID can be a contributing factor to that. So just to make people aware that there are, you know, lots of other things that can go along with this as well. So it's not just COVID. Okay. So again, a couple things I do want to say, and there are some studies that were done, and one has been published and one is soon to be published. The one that's published talked about the reason why it appears that children seem to clear these infections faster. It's showing that children appear to be clearing COVID faster, and that's why they're not having a lot of the symptoms. And that may explain why kids aren't getting sick as often. So in other words, the immune system that the kids have, of course, is different from adults, but it appears that the immunity that children do have are able to kind of fight through COVID faster. And the other one talks about there are antibodies that are being found in some patients with COVID. Antibodies are what the body produces to fight things off, that appear to have a rheumatoid type relationship, similar to lupus and rheumatoid arthritis, that can affect the immune system. A lot of these people are what in medicine, what we call long haulers, which means that they have COVID, they've cleared the virus, but they're still having some symptoms. And it appears that it's antibody or immunologically related to what's going on with their immune system, which it would fight off, normally fight off infections. But when the immune system turns on itself, it can cause what's called autoimmune conditions. And that's the reason why it appears in some cases that steroids are helping with some severe COVID patients, because it does kind of calm the overactivity of the immune system. Okay, good.
Thank you. That was definitely thank you, first of all, for all of that great information. That was definitely another thorough assessment of what's going on with us in the United States, globally, and of course in the state of South Carolina when it comes down to COVID-19. And we definitely can't let our guard down. I was it yesterday? And you may have mentioned this, was the day that over 100,000 cases were recorded.
121,000 over. Wednesday was the first time that it was over 100. And Thursday it was 121,000. And again, this is still with under testing. There were 29 states. There were 29 states. That's why I wanted to put that graph up. There are 29 states that are not meeting their targets on how many tests should be done daily. There's 43 states that are showing significant increases in new cases right now. And 17 states have hospitalizations that are record numbers in the states. 17 states. So, again, this is real. And again, the people that are downplaying it, minimizing it, thinking that it's not real, there's been over 1,500 nurses that have died worldwide from COVID and COVID-related conditions. 1,500. It's worrisome. It's worrisome. I've had over 200 patients with COVID. Okay. Unfortunately, fortunately, only 2 of them died. Unfortunately, 2 of them were family members of mine. So, again, this is real. It happens. A lot of times people will minimize this because they may not know anybody who has died from it. They may have had it themselves and it may not have been that bad. But the concern that we have in medicine, the concern that I have, is we don't know what long-term conditions will result from having COVID. We know that there's studies, like I just said, about the antibodies attacking the body. We know that, I know that I've got patients who have COPD who went in the hospital without oxygen, who are now on oxygen and will probably be on oxygen for the rest of their lives. So the question is, did that person really recover? We know worldwide 35 million people have recovered. In the United States, 6.3 million people have recovered. That's recovered and is in the respect of not dying. There's a lot of people that have not recovered because their condition is worse than before they had COVID.
Right.
So did that person really recover? I contend not. So, again, the medical community has a lot to be worried about, not just the rest of this 2020, but for years to come, with patients who you're taking care of whose conditions have worsened. Vast majority of my patients that had chronic conditions have worsened, whether it be diabetes that got worse, whether it be respiratory issues that got worse. I've had patients that have had strokes that were COVID related or appeared to be COVID related.
And that's because their immune systems are more compromised.
COVID is an inflammatory condition.
Okay.
It creates inflammation in the blood vessels.
Okay.
If there's inflammation in the blood vessels, it doesn't allow the blood to flow as evenly as it should. Hence, less adequate blood flow to the heart, thus heart attack. Less adequate blood flow to the brain, thus stroke. Less adequate blood flow to the kidneys, thus dialysis. I've had at least 10 patients that have had COVID that have had to go on dialysis. Now, the good thing about it, the majority of them it was a temporary dialysis, but a few of them are permanently on dialysis. So there's a concern here that is not just recovered in terms of life or death. It's looked at from physicians in terms of extension of conditions. Absolutely. That will likely be permanent.
Right. Well, Doc, all you can do is, come here whenever we have the show and just continue to educate. And again, this is week 33 that we've been doing this, and we will continue to do it as often as possible. I know when Dr. Mack and I were trying to pull together today's show, one point that he made is that, as far as the information is concerned, I know earlier, maybe a month or two ago, we were kind of running into like a little information desert almost, where there wasn't a whole lot of information because it was being
right.
Right.
It was being slowed down.
Yeah.
Part of it was at the time the current administration made all the hospital data go directly to Health and Human Services and not directly to CDC. Now, the CDC is under Health and Human Services, but typically the information like that would go to CDC. But the current administration said we're going to bypass the CDC and we're going to go right to Health and Human Services in DC, which would control the narrative of what would come out. So there was still information that was available, but the kind of information that I really wanted that would really tell you the nuts and bolts of this was a little bit difficult for a while. And there's studies that are out, things that are out that say that we still don't know the whole story.
Correct.
Because the way that you determine how much this thing is really progressing is the hospitalizations. Okay? Because that's going to tell you the sickest people with COVID. And so that's how you can determine or have some kind of extrapolation on how the death rates would go as to how many people were hospitalized. Were they on a ventilator when they were hospitalized? I mean, so it's all kind of information that was going into that hospital data that was so important that the CDC was given that the government decided that they needed to control the narrative on that.
Well, I know that typically whenever you do the COVID-19 updates, you also try to give kind of a bright side picture. You talk about recovery and all that good stuff. So share.
And the bright side is that, like I said earlier, worldwide, over 35 million people have recovered. In the United States, over 6 million people have recovered. But again, the concern is that if we do what we're supposed to do, we can control the narrative. As long as we don't, COVID will continue to wreak havoc. We are the variables. COVID is the constant. If we as the variables do what we need to do and we change, because variables can change, then the constant will go down. It's a math equation. It's simple math. It's simple physics. It's simple geometry. When we as the variables do what we're supposed to do, we can control the constant, because the constant is going to be consistent as long as we as the variables don't change.
Well, hopefully with everything that's going on in the next couple of days, we will know the outcome of the presidential election, and hopefully the outcome means that we will be able to move out of COVID land soon. That there will be some changes and shifts in America and the way things have been done. And that's it's amazing that we can attribute it to, we know exactly where it all began, and hopefully we won't repeat that moving forward, because I do believe that's the number one priority in this country. If we can get COVID under control, then we can move forward and start to rebuild and do the things that we need to do as a society. So
it was absolutely horrendous that the rhetoric that was being given that we're rounding the corner on COVID, when days before the numbers were still days before the election, the numbers were still in the 70s, 80,000 confirmed cases a day.
yeah.
So it's only a matter of time, if you understand statistics and graphs and geometry, that these numbers were going to hit 100,000. It was only, and the University of Washington Biostatistics Informatics predicted this. They predicted by November we would have 100,000 cases per day. I mean, they predicted that.
It's happening.
And so that's a fact. And the concern is that, you know, as we get 230,000, you know, it's likely we can hit 250,000, 250,000 before the end of 2020. And so again, it's staggering to imagine that is a nice sized city.
Yeah.
You know, it's a nice sized city that's gone. And the unfortunate thing about it is people who were trying to live and work and do the right thing. Quote unquote, first line workers, quote unquote, medical people, food service industry type people that were just trying to live their life, trying to take care of their family. You know, bus drivers, cashiers at stores. I mean, people just trying to live, you know, and people like myself who've dedicated my whole life, our whole lives, to help protect and serve other folks. And so it's tough. A change had to be made. And again, you know, politics aside, right is right and wrong is wrong. And at some point in time, you got to have a heart about it, and it can't all be about politics. It can't all be about money, because, you know, keeping it real, the stuff that Trump was saying, stuff that Trump was talking about tax wise, it would benefit me. It would benefit me. I'm one of the people that would benefit. Okay, his tax structure, I'm one of the people that it would benefit. That's just the true fact of the matter. However, it's more than money.
Correct.
It's more than dollars and cents. It's more than that. It's more than that. But believe me, his plan would benefit me. Okay.
I think what's interesting is that the main people who are shouting about 45 having the best interests of certain people or all the people in mind, they obviously lack the moral compass that you have, because they're the ones who support him for the very reason that you just mentioned. They're supporting him because of the money, you know, and you know, the gains. And I've seen enough comments and have gotten into enough internet war, so to say, in terms of conversations, just wondering, you know, what exactly, and I've even asked the question the past couple of days, what did you vote? Why did you vote for him? You know, what were you voting for? What was the appeal? You know, and it can't be, you know, what we see, because if it is, then I want to know what kind of lens they're using.
Well, we become a society of me instead of a society.
Yes, absolutely.
And, you know, again, the tax structure that benefited me. Okay. But I could not vote for him because the rest of the rhetoric was not where it should be.
Not where it should be. And those persons who are only making $20,000, $30,000 or $40,000 a year are really struggling right now to take care of their families and to live a decent life, because they're actually paying more in taxes than some people, you know, like yourself, or even the billionaires who are paying nothing.
Proportionally to what they bring in, you're
right. That's right.
But if you're making above a certain amount of money, you know, $350,000, $400,000 a year, you know, and I get it. I understand where they're coming from. I just don't subscribe to that same mentality.
Exactly.
Okay. I get what Ice Cube was saying. I get what Lil Wayne was saying. I get what some of these people are saying, because I get that. I understand that. But thank God there are more people that don't think like that. Thank God there are more people that are governed by a better moral compass than just how many zeros you have in your bank account after the first number. So I just, you know, that's my soapbox on that. it's sad. It's sad that a lot of times those people, and again, and I'll say this way. We're the only race of people that look at entertainers as being our leaders.
This is true.
I'm not going to ever look at an entertainer to be my moral compass on what to do. So Kanye West can sell as many songs as he wants to, and I think he's a great beat maker, but I'm never going to listen to that fool. I mean, what is it that he can tell me?
Right.
What is it that Lil Wayne can tell me about anything? I mean, what is it that they can tell me? What is it Ice Cube can tell me? They can't tell me anything about politics. So we have to be careful on who we anoint as being leaders.
That's true. Now,
he's not my leader. He can't speak for me. None of them can.
Not only anointing them as our leaders, but what we're co-signing on, because that whole co-sign factor to me is
right. And
so that's your character.
All that stuff was smoke and mirrors, and all that stuff was strategically planned on when they said what they said. Okay, if you had a problem, Ice Cube, with what was going on, why didn't you say that in the primaries? Or why didn't you say that the last time and the last election? Why now? Why now? And so anyway, I won't go further than that, but anybody should be able to see through that. Anybody. Now, Kanye West supposedly got over 50,000 votes or something. I don't know. So whoever voted for him, they just as lost.
Everybody waiting for his next album. That's pretty much it.
But again, there is not an entertainer that can tell me or should be telling us what to do.
And the sad part about it is that they have a captive audience. They have people who will pay attention to their every word, and instead of being responsible and principled with the things that they say and thoughtful, even, I mean, just really taking the time to unpack the fact that whatever you say is going to impact the society positively or negatively, and it's going to be a seed that you plant that's going to be really hard to uproot. And regardless of whether or not somebody follows what you're saying, or they create more conversation around it, and there was way too much conversation created around what they were saying, trying to debate back and forth whether or not they were right in what parts and what not. In my mind, I agree with you 100%, Doc. It's like, I don't care if it does need to be a conversation. This is not the time to have the conversation. This is not the time to start it. And certainly the person who you're having the conversation with is not the person that needs to hear that right now, because his intentions are in question as well. So it is what it is.
We had two choices. We had two choices. That was it. Kanye West wasn't one of them. Right. And then the other foolishness was, well, just don't vote. Well,
yeah, that was the other part.
That. I mean, you had people that fought, died, sacrificed, had all kind of stuff happen to them to make sure that everybody had the right to vote. So for somebody to say, well, I'm not going to vote because the system's rigged, what is that? Or I'm not going to vote because my vote doesn't count. Well, if your vote didn't count, people wouldn't be trying so hard to not have you vote.
Exactly.
If your vote didn't count.
Exactly.
So, again, I believe in God. I believe things happen for a reason. I believe that what has happened was ordered.
Yes.
Okay. And what's going to happen was ordered.
Absolutely.
Just from a medical standpoint, getting this Affordable Care Act repealed would have been disastrous. Okay. Absolutely disastrous. You've already got some states, including South Carolina, that have not expanded Medicaid because they didn't want to do some of the things that the government wanted them to do, which was simple stuff. It wasn't anything major. But if the states didn't do what needed to be done, the states didn't get matching funds from the government. So because South Carolina didn't do it, you got women, infant, children, poor, handicapped, disabled that had to get kicked off of Medicaid. Some of these people got kicked off of Medicaid because they made $70 too much a month.
That's right. And that's ridiculous.
Because there was only so much money to go around for Medicaid. There had to be hard numbers on how much you made or didn't make to be able to qualify for it.
Mm-hmm.
So now every day I'm having to try to get patients inferior medicines. Patients are trying to rob Peter to pay Paul to take care of chronic conditions. And oh, by the way, if your chronic condition is not treated, you're going to be at more risk for having a bad outcome if you get COVID.
Mm-hmm.
So all these things are being voted on by people who have the best insurances, whose families have the best insurances, and they don't give a rip about other folks. It's selfish.
It is
And
completely.
so I didn't realize I was going to be on a soapbox today.
It's
But
okay.
this is the truth.
Our
It's
reflection.
not my truth. It's not my truth. It is the truth.
Mm-hmm.
But it is a truth that I have to live every day. And so do my colleagues as physicians. You know, you got people that are sick that should go to the hospital to get treated, but they're either uninsured or underinsured and won't go.
Mm-hmm. Mm-hmm.
So this is the reason why in the history of the 100+ years of the New England Journal of Medicine, the most accomplished medical journal there is, for the first time in history, took a stand to say that Trump has to go. It has never said that before. But the way that things were happening, the way that people were dying, the way that there was a lack of respect for people who spent their lives studying medicine, doing research, the way that those people were just casted aside was unbelievable.
And the irresponsibility that he was showing, disseminating information that just simply wasn't true and encouraging people to do things that were just unethical medically.
Let's go through it for a second. Dr. Fauci, as soon as he started saying opposite stuff from Trump, he got banished. The Surgeon General, as soon as he started saying wear the mask and doing different things, you didn't hear from him.
That's right.
Deborah Birx, as soon as she started disagreeing with some of the things like putting Clorox in your veins, whether you meant it or not, she got banished. But guess what? There were some cases from poison control where people tried to drink cleaners.
That's right. That's right.
So you can't just say stuff when you don't know what you're saying. I'm a physician. I'm not a mechanic. You don't want me fixing your car. Okay? Everybody has their lane on what they do, and that's what they should be doing. Mm-hmm. Just because your uncle went to MIT doesn't mean that you know medicine. This is a scientific situation that even the experts, even the people who studied viruses, had to get the grips on this. So why in the world would some non-science, non-medical, non-research person know more than anybody else? Mm-hmm. Okay, so I'm going to get off my soapbox right now.
Well, that was a mouthful. It was a great reflection, and I think that overall this was definitely some great information that we shared. Great conversation that we've had tonight. And, as always, I appreciate you, Dr. Mack, and everything that you do and your staff and, just all of the hospital and affiliates that you come in contact with every day. Just let them know that our community really appreciates everything because there's no way that we could do it without you all. I saw some signs out front of a business the other day, and I thought they were political signs. They were little corrugated yard signs, and the signs, but they were, please wear a mask for the doctors and the nurses. I said, that's what I'm talking about. Please do that. And, now that we have an opportunity to get it right, let's continue to do what we've been asked to do, what we've been told to do. And, the outcome of the election, if everyone has been following it, it does look like we're about to have a change in government, and it's going to be a welcome change because I do believe that we're going to return to what feels more normal to us. And I think that this is going to be a first priority, our health and our well-being. Because of that, it's going to be even more, even more important for us to make sure that we are doing everything possible, that we're being advocates, that we are even holding those people that we are electing accountable, regardless of whether or not we feel like we have a disadvantage. And I'm talking about, what's going on in Congress as well. But still, we see what it's like if we don't pick up the phones and call, or we don't email, or we don't hold them to the fire. And we have got to help the president and the vice president do their job. because, we're electing them to do the job, but we got to make sure they know that we're watching. Just like parents, when you send your kids to school and you never show up for PTA conferences or whatever, sometimes the teachers think, okay, well, that parent doesn't care because they won't show up, the PTO or whatever. And, now we as parents, so to say, we have to make sure that we're showing up to make sure that the ones that we've put in place are governing our country accordingly, and they're looking out for everyone, and that they're bringing about the unity and that we need. I mean, that's a big deal for us as well. I was watching an exit poll on I think it was CNN had an exit poll, and I don't really like exit polls, but because I always wonder, well, who are they asking? Who are they polling? But it was interesting how the economy was the first issue that was of greatest concern to Americans who participated in that poll, and second was racial inequality. Coronavirus was like number 4, and my thought was, I think every issue is important, but I don't know that people really understand that issues catalyze other issues. So our economy is affected by COVID. The racial inequality, COVID affects that as well, because there's disparities in terms of whether or not populations like the Black populations or some Hispanic populations are even able to get the healthcare or the access to healthcare that they need. So yeah, there's so much. It's all a domino effect. It's all interwoven. It's all melded together. If anything, they should have the number one thing they should have said is everything is an issue. Because really, everything is an issue, and it needs to be fixed. So, but Dr. Mack, thank you so much. Can't believe we did this in under an hour and 30 minutes, but we hour and 10 minutes in, it felt good.
Well, we're trying to, like I said, I'm trying to condense the information as much as possible, give exactly what we need, exactly what I think people need to hear. It's very, very crucial to understand this, that there's still things going on. I want to thank you for stepping in last week. Speaking on positive notes, I was with Coastal's football team, and they rearranged the schedule for us to get on the plane at 4:00. So that's why I couldn't be with you. But you did an excellent job.
Oh, I was
nervous. On a positive note, yay for the home team, our Coastal Carolina Chanticleers, number 15 in the nation.
Amazing, absolutely. Way to represent.
The team would be good, but they're really doing some great things. We'll be on. Gotta give a shameless plug for a minute. We're gonna be on ESPN. I think it's ESPNU tomorrow at 8 p.m.
Okay.
Watch us, follow us. These young men are really doing their best, and they're doing good. The coaches, the coaching staff. And the staff, we're just trying to keep these kids going. I know there's still some controversy about, whether we should even be playing sports right now. But again, it's what we're doing. So my job is to try to keep these kids as healthy as possible.
That's right.
This has been a challenging year. Out of the 18 I've been with Coastal, it's by far been the most challenging for a number of reasons, but certainly COVID being first and foremost. But we've done well. I'm proud of them. And it's just a matter of just kind of, just continuing the momentum, playing hard, and you always need a little bit of luck.
Always.
You need a little bit of luck.
There
Okay.
All right.
So thank you all.
Well, thank you, Dr. Mack, and I guess we'll do it again real soon. And and so we hope that everyone again just kind of stay vigilant, stay safe, be patient. We're getting through this. Probably the next time we see you, we will have a new president. Yes. The election will be over, and we'll talk a little bit more about that. We'll continue to come up with some other good topics and cameo appearances. So, but we appreciate all of the support. Thank you so much. And everyone have a safe weekend. Okay. Remember, mask up, wash your hands, social distancing at all times.
Yes.
Take care.
All right.